Welcome back to Medical Monday. It is your chance to call in tonight. If you have questions about sleep apnea, our guest tonight is Dr. Leif Swanson, a dental surgeon. And when I was first told we were doing a show on sleep solutions and a dentist was coming in, I was like, no, something's wrong. This isn't how it's fixed, but it is.
I know.
Is that the kind of the head turn that you get from a lot of people?
Well, it's strange because, in dental school you're always, you're taught to just be fixated on fixing the teeth. And now, I think it's great because we're more preventative and we're looking, at, say, the forest instead of the trees. We're actually looking at, why are we getting some of this tooth erosion, like why are we, seeing the patient grind and seeing certain, lesions in the gums and stuff, and looking at more head and neck anatomy, and like, when people grind, their masters get really big, and like, why is all this happening? So it's been nice to be part of something that's been progressive medicine, but at the same time it's preventative, which I really strive to do at our dental practice. So, by
the way, the name of your dental practice?
Swanson Dentistry.
That's easy to remember. Yeah. Down in Manchester, which is your hometown.
Yep.
You returned there in what, 06? And
I did.
Set up shop and been going since then.
Yep.
This is a big deal for you, this oral appliance that deals with sleep apnea. We were talking a little bit about when people come in and how they can do a sleep study even at home, which I would think is a big benefit if someone is looking at that sleep study.
Exactly.
What happens after that? If they become a candidate for this appliance, what's the next step?
So I think a lot of people, and hopefully, this might answer some of the people's questions too, because a lot of people are like, well, this is a dentist, so is this going to be covered under my dental insurance or my medical insurance? Well, the nice thing about this is actually it is covered under your medical insurance. We can now do what we call cross-coding, where even if we have a doctor sign off on the sleep study, we can actually bill it to their medical.
Gotcha.
And so, I have a really awesome lady that works for the Sleep Relief Solutions and is very apt to handle all the insurance stuff and the questions, because there's so many insurance out there, and what covers what. So luckily that's out of my hands.
Yeah, you got to have an expert that knows what they're doing.
I have an expert that handles that, for sure.
Those people are invaluable, absolutely.
Absolutely. She's
okay,
invaluable.
So people are set up to get this oral appliance, everything's been checked off. Then what? Is it casting of the mouth or molding? What is it?
We do. So once you come in, we do an oral examination. We make sure that you can open wide enough. We make sure you can kind of protrude or push out your bottom jaw enough, and decide on what kind of device we can make. Yes, it's just 2 simple impressions and a bite, and that's pretty much it. It's that simple. And I'm actually now starting to get into doing even more, like with some of the labs doing digital scans. So hopefully before too long we may even have some mobile places where we can just do digital scans and send it into the lab, and not even have to do impressions.
And then how long does it take to get that mold back?
Depending on what lab that we use, it usually takes anywhere from 2 to 4 weeks.
I'm sure people say, why this and not a CPAP? What do you tell them?
Well, that's a really good question, because we are not trying to actually replace the CPAP, because some patients actually need that. These more severe cases, they need that continued positive pressure, going into their lungs. But this offers an alternative for people that can't wear it, and we see the compliance on the CPAP dropping. So, and we see with, as they're, getting better at making these appliances, we see the compliance on it raising. So it makes it just makes more sense. Obviously for people that travel, it makes more sense to carry a retainer case than an actual case, to actually put your CPAP in. It makes more sense to have a significant other in the bedroom and just have an appliance in the mouth versus a big mask and hoses and having to deal with all that. So to me, for a lot of these mild to moderate cases, to me it just makes more sense.
And that is the patient that you were looking for when they get back that sleep study and it says mild or moderate.
Correct.
Perfect patient for this.
Well, it's perfect to treat, and we're actually diagnosing them with obstructive sleep apnea, and please keep in mind, there is a difference between that and central, which when it comes to central, when it comes to the brain, we they have to have continuous positive airway to that. So the oral appliance won't help them with that, but the ones that have the obstructive that just need to take basically the kink out of the airway works perfect.
I want to remind you again, this is open line. This is Medical Monday, I should say. It is your chance to call in with your questions. 615-737+. I'm looking at the lines. They're open right now, so don't be afraid to be the first person to call in. It is your chance to get some free medical advice, and that is hard to come by these days. So call Dr. Swanson. He can help you out. I do want to talk about the overall cost of this. We talked a little about insurance helping to cover the cost. What is the cost?
So that's the million-dollar question. The cost typically runs anywhere from $3,000 to $4,000.
So it's really an investment.
It's really an investment, but if you look at the overall expense, I mean, that covers, you know, a 3 to 4 year warranty on it. You know, that doesn't cover if your dog wants to chew it up at home, but it covers some adjustments, and also if you want to make sure after a year you've been wearing the device and you want to have another take-home sleep study to say, hey, you know, what is my AHI, which is our apnea-hypopnea index, which we use that a lot. Is this device actually helping me? So we put that in there to show that, you know, we are helping the apnea by showing it through a sleep study.
What are you hearing from some patients who have tested this out for a while?
Well, it's amazing that we hear from the spouse that they really are happy that, you know, their spouse or significant other actually went through with it, because I think, you know, it's almost intimidating to just admit that you have this. They're like, well, I'm not noticing any problems, because it happens to be a disease that it's a slow progression. You know, chronic fatigue, you know.
Doesn't just hit you one day.
It doesn't just hit you in one day. It slowly, you know, kind of creeps up on you. But I think the snoring is a dead giveaway. And when you hear somebody gasping for air at night,
that has to be scary.
That has to be scary for the other person. So, you know, I even have, you know, patients my age that are getting treated. They're like, I never knew that this was going to make such a big difference in my life. You know, I have little kids, you know, I have a full-time job, you know,
trying to keep up with life.
And I'm actually able to go home, wake up, and feel like I got a good rest.
What about the care for this? What do you have to do?
The care for it's super simple. It's you know, with an appliance like this, all you're doing is you're taking it off, and you can take the bristles of your brush with some toothpaste, or we even have some special cleaner that you use, clean it, you know, after you get done use it, put it in your container, and it's, you know, really, really easy. I
noticed on the side here, it looks like, I don't know if like a brace is binding, or what is that?
What that is a simple adjustment that we can you see it through there?
Yeah, aim it at camera forward right here. Yeah.
It's a simple adjustment where we can just basically move that lower jaw back and forward.
Okay, interesting.
And you know, another thing I like to talk about too is with these appliances, you know, we're now getting, you know, some of the commercial drivers that have to be tested. You know, obviously they have to be tested for their health, but they're also having to be tested for obstructive sleep apnea.
Like truck drivers.
Truck drivers. Yeah. Any kind of commercial driver now is having to be tested, and if they are diagnosed with sleep apnea, they have to show compliance.
Wow.
To wearing something for 4 to 5 hours a night. Well, the sad thing about it is when they're given a CPAP, you know, that percentage that we're talking about. Yeah. And it's also hard that it has to be hooked up to a Wi-Fi. So, you know, the company has to be able to read, you know, if they're compliant, if their driver's compliant with that. So we actually have an appliance that actually has a FDA approved chip in it. And so they just wear the appliance just like anybody else would. And once they need a compliance reading from, be it the owner of the company or whoever's in charge of their HR at the company, they can take the chip out of the appliance, put it on a reader, and download it right to their computer, and show that that driver is compliant.
Isn't technology crazy these days?
I mean, I think that would be a huge thing for, you know, a lot of these companies that are losing drivers because they can't show compliance for the sleep apnea. Makes
sense. We do have Dorothy on the line calling in. Dorothy, you're our first caller of the night. Thanks for being with us. What's your question?
Yes, ma'am. I would like to know, I had COPD, and I was diagnosed with it, and I took a sleep apnea. I didn't do too good with it, but they also issued me a machine that I brought home, and I'm not doing too well with it because it seems like it shortens my breath. But I'm trying to do it, but they said I need to keep it on 4 hours, which I can barely keep it on an hour. But I'm trying to do it because I can hear myself breathing real loud when I have it on. But then it seems like it gets too rough for me and I can't handle it. So what can I do about it? How long will it be before you think I could get used to it? Will I ever get used to it?
That's a good question, Dorothy. I'm going to put you on hold, so listen to your TV now, okay? So Dr. Swanson can answer your question, okay? Thank you for calling in, by the way. So it sounds like she perhaps has a CPAP machine that she just can't get used to, and I've heard a lot of folks say that, and so then they stop using it, but she's like, I have to be on it 4 hours. Any tips for her, or from dealing with insurance, dealing with, you know, doctors in this area, making that transition? How do you do it to this appliance?
Well, first of all, Miss Dorothy, I hope you're having a good evening. First of all, what we'd have to do is we'd have to look at her sleep study and see if she is a potential candidate. You know, since that she has a compromised medical history with the COPD, you know, that might make it a little bit more complicated if we can just treat it with an appliance. But before I could answer her question, you know, and try to help her out if she's not compliant with the CPAP, I'd have to see, you know, exactly a sleep study before I could say yes or no. And it's really hard with, you know, even a new appliance to be put in the mouth to get used to it. And you know, even with the CPAPs, and it's something that's hard to listen to, which I hear that a lot. Yeah. You know, before I could say you're a candidate, you know, we'd have to see a sleep study and obviously her medical history as well.
How long are your patients telling you it takes them to get used to having this in at night?
You know, I think it varies from patient to patient. You know, I think some of the younger patients, they adapt a little bit better than the older patients, but you know, that's not typically, you know, always the case. Sure. But you know, I'm going to say on an average, maybe a week to 2 weeks or something like that, you know, to get used to having something in your mouth every night you go to sleep.
And Dorothy said, you know, she's been instructed to wear hers at least 4 hours. Is this something that you would wear from the time you go to bed to the time you wake up, or are people taking them out halfway through?
Well, since it's like we take actual dental impressions with it, it's really hard for them to get that out, you know, at night if they're just, you know, with a CPAP machine, they can toss over and, you know, just pull their mask off and you know, disregard that. But with that, it being in the mouth, it's a little bit harder, and so they tend to wear it, from the time they go to bed to the time they wake up.
Now, does that mean it's hard to get in? You have to jostle, or is it just?
It does. It kind of has to snap in. You know, it's not like a mouth guard or anything. It does snap in, but it's not that hard to get in and out.
I'm sure once you get used to it.
But I mean, dexterity with any kind of appliance like that, you know, even with some of our, you know, dental partials and stuff like that, there's always a dexterity issue, you know, of getting in and out for certain patients.
Sure. Okay. Dorothy, I hope that we helped you a little bit. It sounds like a trip back to the person who set you up with the CPAP machine may be in order, to see if you can kind of come up with some different solutions there. Is this something that people are going to have to wear for their lifetime if they're dealing with sleep apnea and this seems to work? Is it something that's always going to be needed?
Well, it depends upon the airway, but yeah, if say weight, you know, being overweight is an issue and having, you know, all that extra bulk in their neck, constricting the airway, then yes, it'll always be something that will be needed, you know, to make room or unkink, you know, so to speak, the airway. So, but you know, the nice thing about it though is, you know, what I'm seeing from some of the patients is they're like, you know, now I have the energy to actually, hey, get back in the gym, or the energy to kind of, you know, get back onto things that I kind of neglected before. So, you know, that's kind of a positive to kind of help, because once sleep apnea starts in like the chronic fatigue like we were talking about, and it starts cascading into all these, you know, diseases,
every area of your life.
Yeah, chronic fatigue, irritability, you know, all the tensions that you may put on stress of relationships. But, you know, once it gets addressed and you feel better, you know, that's going to change the outcome of their health.
Sure.
So.
Okay, we're going to take another quick break. If you have a question, this is a great time to get to call and get set up here, and we'll take your call right after this break. 615-737+ is the number to call. We're coming right back.